What we're seeing in this massive pile, 2,447 pages, is that there are lack of common sense reform. It's filled with costly budget gimmicks and asks the people of America to spend over $2 trillion on proposals that will heap a mountain of debt on our children and grandchildren.
So you got this great promise, and it's not adding up. Do you slow down? Do you begin to think, well, if we can't do everything we promised in the campaign and we love to do and we wanted to do, what progress can we make step by step in a rational way that we can afford in this time of unemployment and unprecedented deficits? No, that's not what they decided to do. What they decided to do was go forward anyway and call anyone that has the temerity to say their emperor has no clothes, that these are Dr. No. You're against everything. You don't believe in any reform. That's kind of the ideas we're hearing here, and that's not correct. So the bill is just too much. It goes too far, too fast, costs too much. We don't have the money. The American people know this. That's why they oppose this bill.
I've heard my colleagues here in the Senate on the other side talk repeatedly about the Republicans not having their own solutions, their own plans. Well, I have to say, maybe the reason that they haven't been seeing the Republican solutions is because they have been hiding behind this voluminous 2,100-page bill at a cost of $1.2 billion per page. Now, Republicans, I can probably say hundreds of times, if not thousands of times, have come down here on the floor and outlined a step-by-step solution to dealing with the health care crisis in this country and the concerns that most Americans have, which is the high cost of health care. But unfortunately, I think many of my colleagues on the other side perhaps have not been able to see that because they can't see around this $2.5 trillion expansion of the federal government that they seem intent on pushing through the United States Senate. Now, I thought it was interesting that last week when the President was in Asia, that the Chinese raised the issue with him about what happens if health care reform passes in this country. And they weren't worried about universal coverage or a public option. You know what they were worried about? What impact it's going to have on the deficit. And in fact, according to the New York Times, in their reporting on his trip, the Chinese wanted to know in painstaking detail how the health care plan would affect the deficit, said one participant. They're worried about their investment because they're the biggest buyer of American debt.
When I talk to Louisianians specifically about health care, not just these broader trends and these broader concerns that they're very focused on, but specifically health care. Okay, we have to fix certain issues in health care. What's the top issue? Virtually everyone in Louisiana says cost, ballooning cost. Whether they have coverage now or whether they're struggling to get coverage, the issue is cost. What can we do about cost? And again, Madam President, this bill does nothing to fix that. It makes it worse. As was illustrated with Senator Thune's graph, it pushes the cost curve up and not down. And part of the reason it does that is in that $2.5 trillion of activity, there are enormous taxes, and those taxes become built in to health insurance premiums. And so premiums don't go down, they go up.